Hello, and welcome to the Group 20 Health Consulting Team's presentation for the Johns Hopkins Wilmer Eye Institute leadership team on the impact of sustainability in ophthalmology at Wilmer. My name is Sausan Javid, and I will be presenting on the current state of the ophthalmology market. My colleague Rohan Birsing will then discuss the future changes and challenges coming to the market. Afterwards, Rola Hamid will discuss the effects of these changes on the institution and stakeholders. And finally, Salia Farouk will present our strategy and recommendations for turning these challenges into an opportunity. As leaders of one of the nation's most respected ophthalmology institutions, you are well aware that the landscape of healthcare is rapidly changing. We now stand at a crossroads of innovation and responsibility, with an opportunity to solidify Wilmer's position as a pioneer in sustainable ophthalmology. Our project aims to analyze, strategize, and provide recommendations to aid Wilmer Eye Institute with the adoption of sustainable practices. The ophthalmology market in Maryland is currently a monopolistic competition market, with the Wilmer Eye Institute and several other large competitors leading the industry. Maryland has one of the highest concentrations of ophthalmologists in the country, with 0.94 ophthalmologists per 10,000 people. This creates a highly competitive environment. On the broader scale, the ophthalmology market is experiencing significant growth. The global market is currently valued at $77 billion and is expected to reach $144 billion by 2034. Here in the United States, demand for ophthalmology services is projected to increase by 30% between 2020 and 2030. This is largely driven by an aging population and rising prevalence of conditions such as cataracts, glaucoma, and diabetic retinopathy. As more patients seek care, institutions like Wilmer must continue adapting to meet the growing demand while maintaining the highest standards of clinical excellence. With strong competition and increasing patient volume, maintaining market leadership requires a commitment to efficiency, innovation, and patient-centered care. Wilmer Eye Institute is well positioned to not only sustain its leadership in this expanding market, but also to shape its future by adapting to emerging key differentiators such as teleophthalmology and sustainability.
The ophthalmology sector is undergoing a major shift towards sustainability. Green operating rooms are cutting surgical waste by 50%, saving centers up to $250,000 annually. Teleophthalmology is reducing patient travel and carbon emissions, saving up to 372 kilograms of carbon dioxide per visit. Regulatory bodies like the AAO are pushing for eco-friendly practices, while pharma companies are launching multi-dose eye drops that cut waste by 30%. Even eyewear recycling programs are growing. Initiatives like Lions Recycle for Sight have repurposed over 30 million glasses worldwide. These changes aren't just good for the planet, they are improving patient care and cutting costs. Wilmer Eye Institute has the opportunity to lead in sustainable ophthalmology through innovation. By expanding telemedicine, the Institute can reduce in-person visits, cut travel emissions, and enhance patient access. High-volume surgeries like cataract procedures can be modified to lower their carbon footprint. Transitioning to reusable surgical instruments and multi-dose eyedroppers will significantly reduce medical waste. Sourcing recyclable materials and adopting greener technologies will not only cut costs but also position Wilmer as a leader in sustainable eye care. Let's build a future where innovation drives both excellence and environmental responsibility. Wilmer Eye Institute has an opportunity to advance both equity and sustainability through cultural competence. By expanding telemedicine, we can reach underserved communities, reduce patient travel time by 30%, and lower carbon emissions. Implementing language translation services will improve patient-provider communication and reduce appointment cancellations by 20%. A culturally inclusive eye care recycling program can ensure donated glasses serve local communities in a meaningful way. Additionally, teleeducation can train 95% of the staff in culturally competent care within 6 months. These initiatives will enhance access, sustainability, and Wilmer's leadership in equitable eye care.
The two primary stakeholders in Wilmer's sustainability initiatives are the Institute's organizational leadership, some of whom are present here with us today, and healthcare providers, including ophthalmologists, optometrists, and staff. We also can't forget about the secondary stakeholders that will be affected by these initiatives, which are patients, especially those who will benefit from the improved access to care, and the community organizations that will act as partners to support the implementation of the different initiatives. We anticipate an enthusiastic response to both the financial and influential benefits of the recommendations that we have for you today, as our research confirms that they will lead to cost reductions. This is because sustainability strategies like reusable instruments and reduced pharmaceutical waste will lower operational expenses. Additionally, sustainability will enhance Wilmer Eye Institute's reputation, attracting environmentally conscious patients and positioning the Institute as a leader in sustainable healthcare. Although we are highlighting the benefits of our recommendations, it is important to also recognize the potential challenges and mitigate them. Successful implementation of our proposed initiatives requires strong stakeholder buy-in. Engaging leadership, healthcare providers, and patients through targeted strategies will be essential. Our proposal emphasizes community engagement by incorporating culturally competent solutions for managing innovation and change. However, several stakeholder concerns may hinder adoption. We understand that the initial investment costs for new infrastructure and equipment could deter some providers. Additionally, resistance to change among physicians and staff could pose challenges, as healthcare providers will be responsible for adopting new surgical practices and teleophthalmology services. To ensure organizational buy-in, Wilmer Eye Institute's leadership must clearly communicate with stakeholders to address these concerns. An inclusive sustainability committee to communicate leadership goals and training programs on new surgical techniques will be essential. Incentive programs can further encourage providers to implement these changes. While some resistance is expected, demonstrating measurable benefits will increase acceptance and adoption. And now I will pass it on to my colleague Salia, who will take you through the quantitative and qualitative measures of the recommendations.
Our recommendations will focus on qualitative and quantitative metrics. To start, we'll focus on quantitative metrics. Our recommendation to Wilmer is to expand on telemedicine use and patient access, and we believe that this will result in a growth rate of about 18% from 2025 to 2026. This will also result in some time saving in travel time, which is about 15 minutes on average per consultation, and also it can reduce carbon emissions by 15% over 5 years. As you also saw in our report and in all the details that we shared, waste reduction and cost saving is also a priority for us and a plan for Wilmer. We think that our plan will result in a 20% reduction in total waste volume and cost savings of about up to $1.5 million per year. Finally, we think that the market competition is high. The HHI index as of now is about 1,200, but with this new plan, it is anticipated to go about or to increase about 1,400. But with all the interventions we're talking about and the possibility of Wilmer being the leader in sustainability, we anticipate that by time, Wilmer could be the lead in this field and could shift the HHI index to a higher level and potentially a monopoly. Moving on to qualitative metrics, we would like Wilmer to keep including and engaging key stakeholders such as Wilmer staff, patients, and community leaders, and conducting periodic surveys. Initial pre-implementation surveys are already showing perceived improved efficiency in workflow at Wilmer, and also patient satisfaction factors are already showing that there is improvement in perception of access to care because of expanding telemedicine. We also would like to keep our focus groups. We think that they've been fundamental in our implementation plan, and there's already a lot of support for telemedicine by these groups because of higher access in in rural areas and underserved areas. And finally, we would like to keep our community leaders involved and using their expertise to help us with the implementation plans. 82% of our community leaders are already supporting these green initiatives, and they believe that this can result in significant cost savings and waste reduction. In conclusion, by implementing evidence-based sustainability practices, Wilmer Eye Institute will not only lead in ophthalmology care, but also will set an example for ethical, sustainable, and socially responsible practices in eye care. Thank you.